Hi, my name is Kaylee. I'm going to be assessing you today. Can you tell me your name and date of birth?
Wangel Mengistu, January 26, 1993.
Do you know where we are today, Wangel?
Springfield, Missouri.
Okay. What are we doing here?
You're doing your assessment on me.
And do you know what day it is?
It is Friday, February 20th, 2015.
Good job. I didn't even know that. All right, come on in and we'll sit down and we'll get started.
Okay.
Okay. So as we came in, I'm going to give us appropriate privacy. So I shut all the doors and we have proper lighting. I gathered my equipment and I washed my hands before we started all of this. And then I wiped my nose and then I washed my hands again. And I was assessing your general appearance as we came in. You had no obvious deformities. You have full range of motion, and your gait was steady and appropriate. Your posture was upright and appropriate, and you had no involuntary movements. Okay. I also noticed that your hygiene is good. You don't smell bad. You are clean, and you don't look disheveled. And your mood and affect and behavior is all appropriate, calm and happy. You don't have any difficulties communicating. You can communicate well with your words, and you don't have any obvious hearing deficits that I can tell. I also noticed that your skin, the areas that I can see are the color is consistent with your ethnicity. I don't see any obvious edema, no obvious lesions. I'm going to look at your hands really quick, see that they're even. Ethnicity is appropriate to your color is appropriate to your ethnicity, and your nail beds are pink. I'm going to be assessing your skin as we go on as well. I also notice that your nutritional status seems good. You seem well fed, and no nutritional deficits that I can tell. All right, we'll get started. I can see that you're making eye contact with me. You're alert and oriented, and you're oriented times 4, and you're awake. No deformities in your head that I can tell right away. I'm going to start with inspection and then move on to palpation, as we will with all the areas of your body that we're going to assess today. So I'm going to assess your scalp, your cranium, and your hair first. And from what I can see, there's no obvious deformities. You have pretty big hair, so it's kind of hard to see. So I'm going to go ahead and feel. I'm going to feel for all of the bones, your cranial bones. I'm going to assess your your mastoid processes. They're symmetrical. Okay. I'm going to assess your temporal arteries. They're strong and equal. Have you open and close your mouth as I assess your temporomandibular joint. Any tenderness? Okay, I'm going to press on your sinuses. Tell me if there's any tenderness here.
None.
Here?
None.
Okay. Your sinuses are good. There's no tenderness or swelling. I'll have you smile. You have good facial symmetry. Okay. We'll go ahead and move on to your eyes now. I'm going to have you hold this paper up to your left eye, okay? And I'm going to have you tell me, this is called the confrontation test. So I'm going to have you tell me when you see my hand, okay?
No.
Okay.
No. No. No.
Okay. All right, we'll do the other eye. I'm going to start again.
No. 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 No.
Okay. All right. Now I'm going to check all of the 6 cardinal fields. I'm going to have you follow my pen light, okay? I'm assessing 3 of your cranial nerves now. All right. Excellent. Now I'm going to shine a bright light in your eyes. I'm going to check your corneal reflexes. Okay. Look
look right at me. I'm also assessing your pupil reactions as we do this. Okay, look right at me. All right, your reflexes are equal, your pupils are equal, round, reactive to light. Maybe look at my pen, the wall behind it. Look at the pen. And one more time. Okay, your pupils accommodate as well. Okay, then I would also, in the clinical setting, I would have you do the Snellen test, and you would stand 10 feet away from a sheet of paper that has a bunch of letters on it, and I would have you start at the top where the biggest letter is, covering one eye at a time, and read from top to bottom until we get to the smaller lettering and you can't read it anymore. That will assess your visual acuity. For the purposes of this examination, we'll just assume you have 20/20 vision. Okay. Now I'm going to inspect your actual eyes and the structures of your eyes. So I would assess your eyebrows, eyelids, eyelashes, and they all look symmetrical, no obvious deformities. I'm going to have you raise your eyes. Okay. I'll assess the conjunctiva, which should be clear, and it is in both eyes. Your sclera is white in both eyes. Your corneas are equal and round, and your irides are both equal and, as we assessed earlier, reactive to light and accommodate. Okay, and then we'll move on to your ears. I'm going to assess both sides and see if they're symmetrical, which they are. Any tenderness or swelling, obvious lesions. I do not have an otoscope available to me. If I did, I would pull the pinna up and back and inspect inside the ear. Do the best I can without an otoscope. Assess the canal. I don't see any drainage, no swelling, no redness, no lesions. I would also inspect the tympanic membrane or your eardrum, which we'll assume is intact and translucent, shiny, should be a gray color, light gray in appearance. And do the same for the other side. Pinna up and back. I would look in the ear canal and assess for the same thing. And then I will have you face forward. I'm going to whisper something in your ear and I want you to repeat what it was, okay?
99.
Okay, and turn towards me.
1, 2, 3.
Okay, sounds great. All right, I'm going to go ahead and look at your nose now. I don't see any deformities or lesions right off the bat. It looks symmetrical, no deviations of your septum from the outside. I'm going to assess the patency of your nares. Breathe in and out. Okay, again. Okay, they both seem very patent actually. I also don't have a speculum, but if I did, I would have you raise your head. And I'm going to assess the best I can. Look in both nares. I'm assessing the nasal mucosa for any foreign bodies. I'm looking for it to be red and moist, which it is. No swelling, lesions, or drainage. Your septum is not deviated. It's straight, aligned, and the turbinates that I can visualize are also red and moist, and no lesions on them either. Okay, now I'll look at your mouth. I'm going to have you open up and just open your mouth wide, and I'll go ahead and take a look at your buccal mucosa. I'm looking for lesions, any abnormalities, and I don't see any. It looks pink and moist, so I'm going to have you smile really big. I'm going to check out all your teeth, okay? I'll have you open your mouth. There we go. And I've already counted. There's 14 on top and 14 on bottom. And have you ever had your wisdom teeth in? You haven't had them grown in yet? Okay, that would be why. Normally you'd have 16 on both top and bottom. I also noticed that they're all white and they're all aligned. You're not missing any teeth. No discoloration, no issues there. I'm going to look at your gums. Go ahead and open your mouth. Okay. Yep, your gums are pink and moist. I don't see any lesions or anything like that. Let me stick your tongue out at me. Okay, and then lift it up. Alright. And say ah.
Ah.
Okay, I'm going to look in the back. Say ah again.
Ah.
Okay. So I've assessed that your tongue is pink and moist and rough on the top as it should be, and on the bottom it's slick and vascular. The floor of your mouth is also slick and vascular like the bottom of your tongue is. The top of your mouth, your palate's both hard and soft, look intact, aligned, and they are pink and moist as well. Your tonsils I grade at a 2. They're visible, but they're not occluding your airway. You've never had those removed, correct?
Mm-mm.
Okay. And your uvula is fleshy and mobile, and I see it moving around, and I assess your gag reflex, and it all looks good. And I'll just have you stick your tongue and move it around at me. Okay. All of your reflexes are good. We'll move on to your neck now. Okay. First, I'm just assessing your neck for any abnormal bumps or swelling lesions, and I don't see any right off the bat. I'm also gonna go ahead and palpate for any lymph node enlargements. Okay, and I don't feel any enlargements of your lymph nodes. They're non-palpable, and it looks like there's no swelling there. Okay. I'm going to have you lay down against the pillow, and I have you at about 30 degrees, and I'm going to check your jugular vein distension. And I do see pulsations just above your sternal notch, but they're not high enough to be considered jugular vein distension, so you're clear. Let me sit back up. I'll check your carotid arteries one at a time so as not to occlude the blood flow to your head. They're strong and equal. Okay. Now I'm going to have you stretch your neck forward a little bit, not too much, and then turn to the right. Okay. I'm going to deviate your trachea, have you swallow. Okay, and to the left. And one more time. Okay, and your thyroid is non-palpable. There's no deviation of your trachea. It all looks good. I'm also going to have you turn your head to the right and left, up and down. Okay. Now I'll have you push against my hand and the other hand. Okay, your strength, and you have a full range of motion, and your strength is equal on all sides. Your neck looks great. We'll go ahead and move on to your chest now, okay? All right, I'll start with inspection as always. I'm just inspecting the symmetry of your shoulders and your muscles in your chest, and I'm also looking at your thoracic cavity. It all looks aligned and symmetrical. I see that your sternum is straight. And I'm going to go ahead and palpate. So I'm just assessing for your symmetrical expansion when you breathe in and out, okay? All right, it looks good. I'm going to assess your tactile firmitis. So I'm going to go ahead and breathe out. Let me get my thumbs in the right place. Breathe in. Okay, I'm going to do the same on the back. And while I was there, I was inspecting for tenderness and masses, and you didn't have any tenderness when I was touching, did you? Yeah. Okay. Go ahead and breathe in. Okay. I see that you have symmetrical expansion. While I'm back here, I'm going to go ahead and just start percussion. So we'll start in all the normal fields where we'll auscultate. No, you're okay. And I'm checking for resonant sounds. Okay, come around to the front and palpate, percuss in the front. Any dull sounds would possibly indicate some issues with your lungs. So if we're all resonant, then we're all good. Have you lift your breasts for me? Okay. All right. All sounds good. I'm going to go ahead and start auscultating, okay? I'll listen to your lung sounds in the same areas we percussed. Every time I touch you with a stethoscope, I want you to take a deep breath in and out through your nose. Have you lift your breaths for me? Okay, you can relax. We'll go to the back. And same thing. Avoiding the scapula. Okay, and now while I'm back here, I'm going to have you do this similar, the same thing every time I touch you with my stethoscope, but this time I want you to say the word 99.
Okay. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, now I'm going to have you whisper 99.
99.
Are you whispering?
Oh, okay. 99. 99. 99. 99.
Okay, I'm going to do the same thing on the front. Say 99 out loud.
99. 99. 99. 99. 99. 99.
Lift your breasts for me.
99. 99.
Okay, we'll do the same thing and whisper this time.
99. 99. 99. 99.
Lift your breasts for me.
99.
Okay, you can relax. Your voice tones were muffled, which is a normal finding, and there's no indication of consolidation in your lungs based on those voice tests. I'm going to go ahead and move on to the assessment of your heart. That'll be the last thing we do, okay? I'm just going to listen with both the diaphragm and the bell of my stethoscope to all 4 valves of your heart, and then I'll listen to your mitral valve for a full minute and collect your apical pulse, okay? You just breathe normally. Your atrial valve, pulmonic valve, tricuspid valve. Now if you lift your left breast, your mitral valve. You hear a strong lub-dub S1 and S2 heart sounds. You have a normal sinus rhythm. And we'll assume for the purposes of this exam that your heart rate is about 60. Okay? I would also listen with my bell in the same fashion. And I believe that that's it.
Well, thank you.
All right, thank you very much.